We turn now to the tragic death this weekend of Chadwick Boseman at the age of 43. The gifted actor, best known for his lead role in Marvel's Black Panther, as well as films portraying the lives of Jackie Robinson, James Brown, and Thurgood Marshall. According to a statement announcing his death, Boseman filmed several recent roles between, quote, countless surgeries and chemotherapy after he was diagnosed in 2016 with colon cancer. Boseman's hometown city of Anderson, South Carolina, announcing it will hold a memorial service this Thursday. The mayor saying the city will plan for social distancing and saying Boseman, quote, touched us all with his talent. Well, we want to continue the conversation now about colon cancer and how we can protect ourselves from this silent killer. Dr. Andrea Cercek is an oncologist at Memorial Sloan Kettering Cancer Center who specializes in this disease and joins us now to continue the conversation. Dr. Cercek, it's so great to see you. And, you know, getting a colonoscopy, it's definitely the key first step in detecting and treating colon cancer. We definitely know that. Yet the various experts seem to give us conflicting advice, like the CDC recommends starting these tests at 50. The American Cancer Society says age 45. And then we hear the sad news that Chadwick Boseman died even younger than that at the age of 43. So what do you think? When should we start actually getting colonoscopies? And what early symptoms should we look out for?
Yeah, so that's a great question and a very important question, as you pointed out. So bottom line is colonoscopies can prevent colorectal cancer from developing and they can save lives. And we know that looking at patients in over 50 who have gotten colonoscopies, we've clearly seen a nice decrease in the incidence of colon cancer. The issue is that we are seeing a trend of early onset or young onset colorectal cancer. And so cancer in patients under the age of 50, where we are not traditionally recommending screening colonoscopies, has been rising steadily since the mid-1990s. So that's the reason now for this debate as to whether or not we should change screening guidelines. And the American Cancer Society decided that based on computer modeling of this rise in incidence, that we should screen younger than age 50, because with this intervention, we will save lives in that age group. Now, the problem is that the fastest and highest rise is actually in individuals aged 20 to 30. But even though it's rising, and it's actually projected that within this decade, by the end of this decade, about a quarter of all rectal cancers and nearly 10% of all colon cancers are going to be in patients under 50, the numbers are still not large enough to justify changing our guidelines to age 20.
So why the rise in younger patients, as you just mentioned?
So we don't know. That is a huge research question. It's a huge dilemma. It's really what we are all working very, very hard to answer. The initial thoughts were, well, perhaps it's obesity. Some of the risk factors that we know have changed in our society. We're more sedentary, our diets have changed. However, that's really not the population that we see in a large cancer center. We've looked at this at Memorial and others have looked as well. And these patients really are not obese. They're active, they're fit. They don't quite fit this profile of what you would consider high risk. So there's something else that is causing this rise in incidence. And it actually happens to be a global phenomenon. It's not just across the United States. It's occurring worldwide.
We also don't talk about it a lot. You know, it's the second most common cause of cancer deaths in the United States. So why don't we talk about it more?
I think it's important to. You know, I don't know why. I'm a colon cancer doctor. I talk about it all day long. I tell anyone who wants to listen. And as you said, it's the second most common cause of death, and it is preventable. And if you had mentioned earlier, if we pay attention to our symptoms, I think that is key for young individuals under the age of 45. If you have persistent symptoms, speak to your care provider, get a colonoscopy if necessary. And symptoms would include things like bleeding. A lot of the tumors are rectal, as I mentioned, so people present with rectal bleeding, bloating, abdominal pain, change in bowel habits, unexplained weight loss and fatigue. Those are all important things to discuss with your care provider if you're seeing these changes and they're not kind of just transient, lasting a few days.
And I think it's fair to say, you know, it's a very uncomfortable thing to talk about, right? We need to be more blunt and more open about this, as uncomfortable as it may be, right?
Absolutely. I mean, there's nothing, it's an organ just like any other. It's a procedure that you get it over with, and it's important. And you know, once we kind of continued this conversation and say, look, just get it done. You'll see that it's really easy. It's not such a big deal. More people hopefully will be aware and will get colonoscopies.
And the Black community is disproportionately affected by colon cancer. How can we best address this disparity?
Yeah, so this is a difficult situation. So we know that in the Black community, the incidence is higher and the mortality is higher from colorectal cancer. What we don't know is this a different biology? Do they have more aggressive disease? Or is it simply access to care? So I think it's the same thing, getting the word out to the communities, to the care providers, internists, gastroenterologists, that this is something that really must happen age 45 and older, and if in younger individuals, if there are any concerning symptoms, it's really something that has to be addressed.
Great advice. Dr. Andrea Cercek, thank you so much for your time.
Thank you very much for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.